Thank you all for joining us for this webinar, The 6 Ps to a Successful Dog Pregnancy. My name is Shelly. I'm the content manager at Revival Animal Health. And I'm so excited because today we have Revival's Director of Veterinary Services, Dr. Marty Greer, and she will be sharing her top tips for a successful canine pregnancy. Dr. Greer has more than 40 years experience in veterinary medicine with special interests in canine reproduction and pediatrics. She received her Doctor of Veterinary Medicine from Iowa State University in 1981, and she has served as Revival's Director of Veterinary Services since 2019. So welcome, Dr. Marty Greer.
Can't even believe that it can be that long. So I have been a breeder since I had my first litter in 1990. I got my first corgi in 1988. So I've been breeding corgis for that long. And then we got Danish Swedish farm dogs in, so 11 years ago, I got my first Danish Swedish farm dog. They are now officially an AKC registered breed. So we went from being in FSS to miscellaneous to being fully AKC registered in the working dog group. And I currently have several of our dogs that already have championships through the AKC. So I'm an active breeder. I'm an active practitioner. So I'm not just telling you what I read in a book one time about this stuff. I'm telling you what really happens in my real practice. So when I go into the exam room and I have clients that are frustrated because they're not getting pregnancies or they're not getting where they want to be with a breeding program, there's a few things that we need to talk about. And I tried to summarize them one day as 5, and then I ended up popping a 6th one onto the list. So that's how it changed from 5 to 6. So we're going to talk about progesterone and vaginal cytologies, which is basically the timing to do a breeding. Secondly, we're going to talk about prenatal care of the bitch and the puppies. Third, about puppy count x-rays. Fourth, about preparing for whelping. Fifth, about planning C-sections if that's indicated. And sixth, provider care. Progesterone testing is really key to having successful breeding outcomes. So we're going to talk about why should we do progesterones, how to use the vaginal cytology, how to time the breeding, the whelping, and the C-section. So progesterone testing is really essential in knowing the timing to do the breeding. Progesterone is not the hormone that creates ovulation. The start of the heat cycle starts with a rise of estrogen, which we don't measure in clinical practice. So the estrogen first goes up at the start of the heat cycle when you start to see vaginal swelling and some bloody vaginal discharge. It rises for roughly a week, and then it will drop. And at the time it drops, then we see an LH peak. LH stands for luteinizing hormone, and that is actually the hormone that creates ovulation. There is a test on the market for LH, but unfortunately it has to be run every 24 hours at the same time every day to nail down when she ovulates, and then you still are going to breed 5 to 6 days after ovulation. So it doesn't help as much as I would like for it to give us a really good answer. Once the LH peak happens, it goes up and very quickly drops within 24 hours. And then we start to see the progesterone rise. And the progesterone is the little yellow dotted line on this graph, which once it starts to rise, it may wobble a little bit. You may get a 1.2 and then a 0.8. That doesn't mean you've missed her. That just means she's doing the normal baseline wobble. Then she may go to a 2.4 and then drop back to 2. But once she gets above 3.5, it's going to rise and continue to rise in almost every bitch. Once it rises, then we know that she's ovulated. We like to breed 2 days after ovulation for using fresh semen or natural breedings, or frozen semen 3 days after ovulation. That's how we do things in our practice. Every vet clinic is going to be a little bit different in how they interpret progesterones and what equipment that they run. And if you're running your own equipment, we'll talk about that. But it's important to realize that not every vet is going to do exactly the same thing based on their experience and what their equipment reads. So please don't take this into your vet and say, oh, you're doing it wrong, because that's not necessarily the case, but that's pretty much a general rule. When do you breed? Like I said, 2 to 3 days after ovulation. Bitches are the only breed that we have, or the only species that we have that doesn't ovulate a mature egg. Horses, cows, humans, cats, when they ovulate, those eggs are ready to fertilize. Dogs' eggs take 2 to 3 days to mature so that they are ready to be fertilized. So ovulation is not the ideal day to breed. It's 2 to 3 days later. It does depend on the kind of semen, but it doesn't really depend on the type of insemination. It depends on the type of semen. So when you're using frozen semen, it doesn't matter if you're doing it with frozen semen with TCI or frozen semen with surgical, it's still the same day because it's frozen semen, not the way it gets there. So why do we use progesterone tests instead of other tests? Well, I mentioned LH is really tricky because you have to run it every 24 hours. Estrogen is not a test that we do in clinical practice. So really we're kind of left with progesterone. And it's very consistent. And when we first started doing progesterone testing, and this was back in the 90s when we were doing this initially that human labs were sometimes running our samples. And in some cases, maybe they still are, because a dog progesterone and a human progesterone are the same test. So we could really easily use progesterones, and they're repeatable one lab to the next. So it's important that you understand why progesterone is the hormone of choice. Sometimes we'll use how receptive the bitch is. Sometimes we'll use how interested the male is. If your female ovulates according to progesterone and your male is shrieking in the kennel because he's ready to breed her, that's a really good sign that she's likely and he's likely accurate about their testing. But every now and then we'll have somebody that calls me and says, the males just weren't interested. I had one yesterday. The male's never interested when the female ovulates, or the female isn't receptive. So sometimes we have to just take that as, what it is, and say, well, we're going to basically breed on progesterone in spite of what the male or the female says. Now, vaginal cytology, we're going to talk about that in a few minutes, because vaginal cytology will align with when the female progesterone starts to rise. So that's pretty useful. LH, difficult to use. Vaginoscopy, that's something that really only vet clinics are going to do. That's when they put a scope in the vagina and take a look at the vaginal lining. And then a lot of people talk about reverse progesterones at the end of the pregnancy to time the C-section. But in my world, it's much more effective, much more cost-effective, and much more safe for you to know the date of ovulation and not try to guess at the end of the pregnancy when to do the C-section. And we'll talk about that. So receptivity, very important that the male is interested, very important that the female is interested. This photograph came from one of my clients. Apparently she didn't have enough to do with her free time, so her dogs got married. I thought that was kind of an interesting photo. I didn't pull this off the internet. This was given to me by a client. So this is how our clients think about what they're doing with their breeding programs. Vaginal cytologies are really useful if you're trying to determine, number one, when should you start your progesterone testing so that you can save some money on progesterone, maybe save some time running back and forth to the vet. Secondly, to know if she even is in heat, because we'll have some bitches come in and they may have a little vaginal swelling, or the males might be starting to sniff her, and people are always afraid that they haven't seen the discharge, or she's just not a dog that shows easily, or she's got a silent heat. So sometimes not knowing if she's in heat is the best reason to do a vaginal cytology. And sometimes we can look for other pathology, and I'll show you what that looks like on the slide. So in proestrus, the cells are going to look like this. They're going to look like big fried eggs with nice rounded edges, a nice dark nucleus in the middle. And that is what the vaginal lining is going to look like when a female is in proestrus. In the background, you're going to see some little gray cells. Those are going to be the red blood cells. That's what a normal vaginal cytology should look like when she's in proestrus, the first 7 to 10 days of her heat cycle. When she gets into estrus, when she's ovulating, the cells change to a cornified cell. These are called parabasal cells or non-cornified cells. These are called cornified cells. They become cornified, meaning that they're more like the skin surface, the epithelium of the skin. You can see that the cells are now larger, they're darker staining, they're angulated, and they often don't have a nucleus. There's only one cell on this slide that has a nucleus, if you can remember back to your biology days. The nucleus is that purple staining part of the center of the cell. And so this is how the vaginal lining prepares itself for the trauma of a breeding, for a tie. So this is absolutely normal that a dog will do this. At this point, you should see bacteria, and you may still see red blood cells. So those little purple dots in the background are bacteria. A dog should have bacteria in her vaginal secretions when she is at this stage of her heat cycle. If you see white blood cells, and I'll show you what those look like in a second, if you see white blood cells when she's in proestrus, that's the sign of an infection. That almost never happens. If we see that, we'll use antibiotics, but every bitch that's bred should not routinely be put on an antibiotic just because you see bacteria. Bacteria are in your vaginal lining. They're supposed to be on your skin. They're supposed to be in your intestinal tract. We have millions and billions of bacteria in our systems, and those are there to protect us against the bad bacteria, so the good bacteria have to stay. So please do not interpret your vaginal cytology with bacteria on it saying that you should use an antibiotic. Cultures are kind of an interesting topic because some people do recommend cultures, but in general, cultures don't tell us very much, because what we know about bacterial cultures on bitches in heat is pretty much the same as we know about bacterial cultures for the male dog. If we culture his prepuce and the skin around his penis, is that every bacteria known to man is okay to be there except for brucellosis. So all the other bacteria are reported in normal dogs, and all of those other bacteria are reported in infertile dogs. So we don't have a good handle as veterinarians to say, oh, that bacteria is bad. They're all supposed to be there except for brucellosis. So don't look at bacteria as being bad. Look at bacteria as being there to protect against the pathogens, the bad bacteria that we don't want in our system. Once the bitch goes out of heat, once she goes into diestrus, you're going to see the cells go back to being round. The nucleus comes back. Now you're going to see white blood cells in the background. So that is a normal diestrus. And then during anestrus, it's going to look very much like diestrus, which is after the heat cycle. And those small purple cells are white blood cells. Again, those are supposed to be there in small numbers. That doesn't mean there's any pathology, only if you see those in proestrus. So this is a slide that shows you on the left a cell that has a lot of bacteria around it. That's absolutely normal. If you see the neutrophils or the white blood cells that are on the right-hand image where that arrow is pointing to the neutrophils, that should not be there in proestrus, but they should be there during diestrus and medestrus and anestrus. So there are 5 stages of the heat cycle, and that's the important distinction. So what are you going to do about doing a vaginal cytology? Well, you can have your vet clinic do it, or you can learn to do these on your own. What you basically need is a swab, a long-handled swab, like a long Q-tip. So Q-tips are too short to get all the way up into the vaginal vault of a larger female dog. So you want to take a cotton swab, not a Q-tip, but a cotton swab. And I never use wooden handled ones because I've had them break off in the vagina, and that's really uncomfortable for the dog and really hard to get them back out. So you want to use a plastic handled swab. You want to slide it up at a 45-degree angle and then forward, and then spin it around in the female's vaginal tract. And then you're going to roll that, not smear it, but roll it onto a slide, and then stain the slide and look at it under the microscope. Back in the days when I started practice, up until about 1995, this is the only way we timed females for breedings. And we weren't doing frozen semen breeding. And we were wildly successful with doing this, because the cell types are so different when they're in estrus versus diestrus or medestrus or anestrus, that it was pretty easy to say, she's out of proestrus, she's in estrus, it's now time to do your breeding. So this is a very successful way to time when she's in estrus, but it's not specific enough to time a C-section, and it's not specific enough to do a frozen semen breeding. It is specific enough to do a natural breeding or a fresh chilled breeding. So you need the long-handled swabs. These have the wooden handles. I would use only the plastic-handled ones. You need a microscope, long-handled swabs, glass slides, and then a stain kit that you can stain in those 3 stains. We do carry these all at Revival. You dip the slide, according to the instructions on the stains, into all 3. The first one is to fix the slide so that the cells stick to it. The second stains in pink. The third stains in purple. Then you look at it under the microscope. And if you want to do some experience, you know, we're going to teach a class on this. I have a handout that's almost ready to go out. So I'm happy to teach people how to do this so that you can help to time your females without doing as many progesterones. It doesn't mean we're replacing progesterone. It means that you might go in 2 or 3 days later for your first progesterone to your vet clinic, but you're not going to time a C-section on this kind of information alone. So that's the vaginal cytology aspect of this. So progesterones, how do I interpret the results? Well, it depends on the machine. Like I said, typically 5 is what we consider to be ovulation, but it can be anywhere from 4 to 8. And you will go on the day of ovulation. So she may be at 4 and the next day she jumps to 8. That's when she ovulated. So that's the information that you need to know, is when she does that rapid jump and she was at above somewhere between 4 and 8, that's the date of ovulation. And that's when we start counting forward to know what day to do the breeding. 2 days later with fresh semen, 3 days later with frozen semen, and 63 days later is when she should have her puppies. So again, here's our graph. It's a really useful graph for you to remember that this tells you when the fertile period is it's after the ovulation occurs and the eggs mature. So if we're doing a fresh chilled or a fresh semen breeding, you can do that with natural breeding. You can do it with a vaginal AI. You can do TCI. You can do a surgical breeding with fresh semen. You can do any of these with fresh semen. Fresh chilled semen, of course, can't be done as a natural because that's semen that comes to you in a box with extender in it from a dog that lives far away from you. Then you can put that semen in vaginally, and AKC does not require paperwork from a veterinarian any longer to do that. Transcervical is TCI. That's when we put the semen in with a scope. That's only done by veterinarians. And surgical breedings, of course, are only done by veterinarians. If we get to frozen semen, we're only going to put frozen semen into the uterus. It's never put in vaginally because only 11% of bitches with vaginal AIs and frozen semen will get pregnant. But we should be 70% upwards if we're using frozen semen and doing it either with transcervical or surgical, where we put the semen directly into the uterus. Frozen semen is stressed semen. It doesn't live as long in the bitch's reproductive tract. It doesn't swim as effectively. So that semen has to be delivered directly into the uterus with either TCI or surgical breeding. So my magic numbers are 5, which tells us the day she ovulated. And then 15 is going to tell us when you do a frozen semen breeding, 15 plus. They'll often be, 18, 22, somewhere in that range. Every bitch is a little different how they rise, and every heat cycle is a little bit different. So you can't predict what happened last March and tell you that that's what's going to happen next March. I have clients that come in all the time and they say, well, she's going to come into heat the 3rd week of March. I'm like, wow, your bitches are way more cooperative than mine, because mine come in whenever they want. So 5 is ovulation, 8 to 14 is when we do a fresh breeding, 15 and above is when we do a frozen breeding. And that's in my hands, my lab. So if your vet tells you something somewhat different than that, please understand that they may be using different equipment and they have different experiences. Peak fertility is 2 to 3 days after ovulation, not the day of ovulation. The lab you're using must be a reliable lab, one that you should be testing and knowing for sure that you're effectively getting answers. Now, semi-quantitative tests are this middle pink well kind of situation. That gives you an approximation of ovulation. It does not tell you enough of a specific number to do a frozen semen breeding or to schedule a C-section with. So in those cases, we're going to want to use equipment that gives us an exact number. So saying it's pinker than yesterday or bluer than yesterday doesn't tell me what I need to know. I need to know a number. So on the left is a TOSO, on the right is a mini vitus. Many people have used these pieces of equipment, and those give us an actual number. They'll give us a 3.5, a 14.7. That's the information that I want. I'm using a quantitative test, not an approximation, when I'm doing frozen semen breedings and timing C-sections. There are other pieces of equipment that people have. We know that the BioNote is out there. A lot of vet clinics have the BioNote. A lot of vet clinics may have the Catalyst One by IDEX. Some will still have the mini vitus. We had a mini vitus years ago, and it's not a bad machine, but it's a putsy machine to run. So we just kind of elected to stop using that. The TOSO, we used our TOSO for so many years that it ran out of warranty and it finally quit working, but that was 18 years in. So we've had some really good experience. And there's a number of other pieces of equipment on the market, but if you're using your own in-house equipment, you need to make sure that it correlates with the numbers that your vet clinic is getting. So if you're running your own progesterones, ask your vet if they will help you to establish what your numbers mean versus theirs. So you would draw a sample at your house, run half of it on your machine, take the other half to the vet clinic, and either they would run it in their equipment or send it out for a test outside the lab, so that you can say, well, their 5 is my 3 or their 12 is my 8, so that you know exactly what your numbers mean. So again, we're going to do our breeding timing from ovulation, so that we know that bitches should have a C-section or should whelp 63 days from ovulation. We will schedule our C-section 62 days post-ovulation unless they're bulldogs or they have an extremely large litter. If it's a golden retriever or an Irish setter with 14 puppies, I'm going to do a C-section on day 61. If it's a bulldog, a French bulldog, a pug, I'm going to do it on day 61. For most other breeds with a reasonable size litter, it's going to be on day 62. Why do I have Dr. Doolittle and a push me pull you up here? Because I want you to remember progesterones help us on both ends of the pregnancy, both at the beginning and at the end, so that we know what our timing should be. Reverse progesterones can cost you a lot of money because you may end up going in every single day. We've had clients come every day for 10 days because the reverse progesterone isn't going to drop in a systematic fashion like it does when it rises. Progesterone drops whenever it wants to. I've seen bitches sit at 3 for 10 days. I've seen other bitches that drop from 10 to 1 overnight. So seeing a 3 on one day doesn't tell me that the next day she's going to be ready to have her C-section. I think reverse progesterones cost you a lot more money than it cost you at the beginning to just get the information. If you are reluctant to run all those, and you can draw your blood, centrifuge it, put the serum in the freezer, and then when she gets pregnant, if you need to know when to do the C-section, you've got that blood, you can run it on your equipment, or your vet can run it on theirs, and you can tell when she should have her C-section. The other things that I will do to time a C-section would be make sure the progesterone is below 2, and that's only going to help us if it's a bitch with a normal pregnancy. Check on ultrasound to see if you see intestinal motility, if your vet can see intestinal motility and kidney development. I want to know the bitch is nesting. I want to know if she's lactating. I may take an x-ray so I know about how many puppies we're going to have. So when I do a scheduled C-section, I want all the stars to align. So I don't just pick one thing that I'm looking at. I am picking multiple things, unless I know for sure the day she ovulated. If I know when she ovulated based on progesterone timing at the beginning, I'll schedule the C-section. If I'm not sure, I'm going to be a lot more twitchy about doing a C-section without all the information. So it's harder to schedule your C-section if you're just doing reverse progesterones. It can be less accurate because it doesn't drop systematically. It can cost you more time and travel than it's worth, and it can require some last-minute arrangements to do a C-section. So knowing progesterone at ovulation, to me, is much more useful than doing reverse progesterones. What is the current state of veterinary care? A lot of our clinics around us that are emergency clinics or referral centers are starting to shorten their hours. They don't always have the capacity to get every case in. There are staff shortages, there's staff burnout. So be really nice to your vet clinic. Take them cookies, take your veterinarian their favorite bottle of wine, go in the summer and do a cookout for your staff. But keep a good relationship with your veterinarians. You don't want to be the person that only calls them when you're in a crisis at 5:30 and they're trying to go out the door. These people have lives too, like they have kids and they have to go to soccer and they have to buy groceries and they have all the stuff. So be nice to your veterinary staff. Okay, prenatal care. We're going to talk about a whole bunch of stuff here pretty fast. Prenatal care, in my world, diet is absolutely critical to supporting good, healthy pregnancies. If we don't feed the machine that makes the sperm and we don't feed the machine that makes the babies, we're not going to have great outcomes. So the only pregnancy diet on the market is made by Royal Canin. It's called HT42D. It has a number of micronutrients and amino acids in it that will help to support successful pregnancies, successful heat cycles. So if you are having fertility issues, you can feed this to both your females and your male dogs because it has some fatty acid ratios that do seem to be anti-inflammatory for both the boys and the girls. I had one client that I was having difficulty with pregnancies on, and I switched her to this, and at the ultrasound, she started to cry because the bitch was pregnant with 9 puppies. And she cried because she said there were too many. So you can end up with some really great outcomes if we feed the right diet. The other diet that I promote and I think is really useful is this Purina Sport 30/20. It's either the Royal Canin or the Purina Sport diets that I recommend. The other diets we've seen may have a series of issues with fertility. So it's hard to compare labels on pet food. You can look pretty easily at the fats, carbohydrates, proteins, and fiber in those diets. Those are the macronutrients. Those are the big parts of the diet that you can see in the kibble. That's easy to measure, easy to compare one bag of food to the next. But the micronutrients, which are anything listed below salt on the label, is a micronutrient. That means it's present in such a small amount that it's really hard to measure. And it's very hard to compare one bag of dog food or one brand of dog food to another. The label doesn't tell you the whole story on vitamins, minerals, and amino acids. So if you're having fertility issues, I ask 3 questions. First is, what do you feed? Secondly is, what else do you feed? Because everybody feeds something else with their food. And third is, what supplements are you on? And that's going to be the questions that I go through if you call me or email me and say that you're having issues. So I'm going to automatically tell you feed Royal Canin or Purina because those are going to be your best diets for good fertility. Raw meat diets, not a fan. I'm not going to say too much about it other than I had an 8-month-old, very valuable female breeding cat, not dog, last week that was on a raw meat diet. And at 8 months of age, she already had a pyometra. I suspect she was eating enough raw with bacteria in it that she turned around, licked herself. The bacteria went up into her vagina, ended up setting up housekeeping in her uterus and creating a pyometra. This is how I feel about raw meat diets. It's like kissing a pig. I don't recommend it. We also know that bitches need carbohydrates to grow their puppies and to lactate. So grain-free diets, pea-based diets that have too much phytoestrogens, any of those diets are not going to help you with good fertility. So a bitch should be on a carbohydrate-based diet without too much in the line of peas. Prenatal care supplements are very important. Revival carries the Oxymate prenatal vitamin, which does a great job of including folic acid and some other things like zinc to improve the red blood cell capacity. All pregnant dogs end up anemic, so it's important that we support our bitches. Folic acid, absolutely critical to be giving, especially to the brachycephalics and other breeds that tend to have an issue with cleft palates. This is a cleft palate on the right-hand side. The other picture is of a puppy with an open abdominal wall, spina bifida, and a cleft palate. So this puppy had the trifecta of all 3 birth defects. Folic acid can reduce the risk of this. It doesn't eliminate it completely, but it does reduce the risk. The only published dose we have for folic acid is 5 milligrams per dog per day, starting 6 weeks before the pregnancy until day 40 of the pregnancy. This is the paper published out of Poland in 2013 that shows a significant reduction in pugs and chihuahuas, both breeds that are at risk of cleft palates, and the reduction by half in pugs and 2/3 in chihuahuas of cleft palates with folic acid supplementation. So I take this pretty seriously. DHA is another micronutrient that I think is really important that we include in our dog's food. It is important for brain and eye development in the puppies, and it is added to some of the Purina diets, some of the Royal Canin diets. So take a look at your labels for that. There was a study done by Russ Kelly at Canine Companions for Independence who raised service dogs, and they ran a study on 5,900 puppies. They know from litter 1, the bitches had a 50% graduation rate. To litter 5, their graduation rate had dropped to 25%. They looked at 200 nutrients and determined that DHA was the key factor in the brain development and the eye development of these puppies that made them successful, that made them smarter puppies. I have a client that's a pediatric surgeon, and she absolutely swears by DHA and how much smarter her puppies are with this. So take a look at your foods. Your puppies are going to be smarter, maybe too smart, if you're using DHA. It is now also added to human baby formula because of that research. So very important that you know DHA is out there. Write this down, write down DHA, because it's also shown to reduce the risk of dementia as people age. So write it down in case you forget. Be Strong is another important vitamin that we carry at Revival that does seem to help bring bitches into heat if they've had a delayed period between heat cycles. You can't force a heat cycle in less than the amount of time that a bitch needs. She needs at least 4.5 months between heats to have a pregnancy. But the Be Strong, if you have a bitch that's dinking around and not coming into heat, putting her on Be Strong frequently will help bring her into heat. And then other prenatal supplements will be the probiotics. With Doc Roy's GI Symbiotics, we see less mastitis, less metritis if we've got our bitches on these supplements. And then Royal Canin now also has a new one that shows a reduction in abnormal sizes of puppies. They seem to be more consistent in size, and they seem to have an improved vaccine response. So there are some great probiotics out there on the market. This one has Bolarde in it. Body condition score, important that our bitches are not too thin or too heavy. I usually have you feel your hand, and if the back of your hand feels like her ribs, that's the right weight for her to be. If it feels like your knuckles, she's too thin, she's a 1, 2, or 3. If she feels like this, she's too fat, she's a 7, 8, or 9. So we want our bitches to be at an ideal body condition score so that they are coming into heat, well-nourished, not too thin, not too heavy. All right, so technically the heartworm preventives are labeled as safe during any part of the heat cycle, except for trifexis. However, I try to time it so that the bitches don't get anything that they don't absolutely 100% need during the first 3 weeks of their pregnancy. So if you're planning on breeding on a heat cycle, you can give your heartworm preventive a little bit early. So give it just before she ovulates when you're getting close. And then you can give it 4 to 5 weeks later. You're still in that window of time. And you can avoid the first trimester, which is when most products, if they're going to create an issue with a birth defect, is going to happen. Also, when you're using your flea and tick products, make sure you read the label. It should say breeding dogs. We do have a flea and tick finder on our website that we can share the link with you that will help you pick those. The only oral flea and tick medication that's safe in breeding dogs is Bravecto. Credelio, Simparica, and NexGard are not labeled for breeding dogs, and breeding dogs are males as well as females. So if you're going to use an oral, Bravecto is the only labeled one. If you're going to use a topical, Frontline is labeled. Selamectin, which is Revolution and Revolt, are labeled, but not all of the flea and tick medications are labeled. And many times veterinarians are not checking the labels as carefully as they should if they're working with you on a breeding program. So you can read those labels, you can pull them up on the internet, and if you type in product insert, put in the name of the drug, and then PDF, it'll bring up that package insert so you can read the instructions. If you don't want to do that, please email us and we have a list. So flea and tick preventives, Heartgard, Sentinel, ivermectin, those are all safe. Selamectin is safe, moxidectin is safe, but only trifexis is the only heartworm preventive that's not, but please be sure you're reading your flea and tick preventive labels. Intestinal parasites are pretty yucky, and a lot of our dogs will have these, especially if they live in the South. If a bitch ever had roundworms when she was a puppy, those will insist in her muscles. During the stress of pregnancy and lactation, they will reactivate, they will migrate through the placenta and into the puppies. So if she ever had those, we recommend that you are using a protocol that we're going to share here on a slide. Hookworms will migrate through the milk into the puppies. Roundworms will migrate through the placenta and into the puppies. Giardia, we don't have a preventive for. They don't migrate through the placenta or the milk. They are fecal oral. Again, coccidia are fecal oral, and that's a prescription item that we would use Albon for. So if you have ever had roundworms or hookworms in your bitches while she was a young dog, if you give her fenbendazole at either the suspension rate of 1 cc per 4 pounds or the granules, you can give this once a day for 5 weeks, starting on day 42 of the pregnancy and going on to day 14 of lactation. And that will prevent the migration of roundworms and hookworms through the placenta, the mammary glands, and into the puppies. So be careful with your dogs that have had parasites. That's going to prevent that issue that you may have. So please be aware that this was an article, or these were articles published in 1979 and 1981. And again, if you want the references to those, I'm happy to send them. Vaccines. Never give a vaccination during pregnancy. Never give a vaccination during a heat cycle. Vaccinate before she comes into heat. Vaccine finders, we have this great tool on our website to help you figure out what vaccines you should be using. Puppy count x-rays. I think this is second only to the importance of getting good semen in the bitch at the right time and having successful outcomes. You want to know on the x-ray how many she's having. If she's got too many, you may schedule a C-section, like more than 9. If she has too few, like 1, you may schedule a C-section. And you also need to know when she's done. If you need to fall, if you fall asleep at 2 o'clock in the morning, is she done? If you find out 3 days later there was a puppy left behind, that can be truly heartbreaking because you can lose not just the puppy, but the bitch. So it's important that you know how many puppies are there to keep everybody healthy. When we're doing our puppy count x-ray, I always have some rules. And number 1 is when you go to the vet, and this is a way to help your vet take more accurate x-rays if you're struggling with that, is number 1, take her in fasting. Don't feed her a big breakfast before you go. Number 2, have her have a stool before the x-ray so you can walk her before you go into the vet clinic. You can put in a match. And yes, we really do put matches in the rectum of dogs or suppositories in the rectums to stimulate them to have a stool. The match should not be lit, to be clear, and the match should be paper, not wood. I take 2 views. I take one with the right side down and one with the left side down. I don't care if you do left and right or right and left, but they should have 2 views. I'll show you in a minute why. Digital x-rays make a big difference in the quality of the x-rays, and it should be taken after day 55, but before she goes into labor. I don't really like taking the first x-ray and see a puppy kind of falling out of the vagina at the time we're taking an x-ray. It should be done before she goes into labor. So get to the vet clinic far enough ahead of time that you have time to walk her. And if she doesn't have a stool, my staff is trained, if they take the first x-ray and there's too much fecal material in the intestines, they don't even take the second x-ray. They put in a match, they take her outside. Well, in June, they take her outside. In January, they send the client outside because they don't want to walk in January in the snow. So have time to walk her so that she has an empty colon. This image shows you how difficult it is to see puppies. All this granular looking material under her backbone is food in the large intestine. So it's very difficult to get a good x-ray when there's too much fecal material in the colon. This is a nice x-ray of the, why we did 2 x-rays is on this view. It looks like there are 2 puppies. When we rolled her to the other side, now you can see that there are 3. So important to know that. And here's another one that will show you why we're taking 2. It just makes it a lot easier. There were 7 on this view. We flipped her to the other side and we could see 8. So it makes a big difference to get 2 views. It makes a big difference that they're not laying on their back. They should lay on their right side and their left side. If you are willing to work with your veterinarian and help them take better x-rays, they can help you have better whelpings. All right, preparation for whelping. You should have a whole array of things. I like to keep all mine in an ice chest so that when I'm ready to go, it's clean, it's well stocked. I can add things that I need to if they've outdated. And then we have a whelping kit, which is going to be your one-stop shop if you'd like to just pop onto the website and take a look at all the recommendations there. So I keep all my things together, all organized, all nice and neat and clean. And we're going to rattle through this pretty fast. So I would never whelp without a whelping nest and nice whelping pads. Whelping box should be at about 88 to 90 degrees and then drop 5 degrees a week after the puppies start to mature. I wish this were my whelping room. I found this picture. It's beautiful. I love this. Puppy warmer incubator, absolutely great tool for saving puppies along with the oxygen concentrator. If you have especially brachycephalics, pugs, Frenchies, I would strongly encourage you to invest in the equipment for the incubator and the oxygen concentrator. The calcium really helps with labor and contractions. And we do have other webinars on all these topics like whelping a bitch. So I'm not going to spend a great deal of time. I will tell you, this is the old label, and this is my dog. She found the old tube of calcium gel in the trash can because I hadn't emptied it yet. And it's so palatable that she was chewing on the end of this tube. Some of the other calcium gels on the market that are not made by Revival aren't very tasty. She would not have been so happy to chew on that tube. If you are going to use oxytocin, you need to have TB syringes and use itty bitty teeny weeny little doses. Many people use too large a dose and they shrink wrap puppies. So make sure you're using very small doses of oxytocin. 1 cc is way too much for even the biggest dog. They should be hundreds of cc's when you're dosing this. And we do have this information. Again, grab your camera. There are times when I never use oxytocin, and that's before the first puppy is born, if she's already in hard labor, or you've done more than 2 injections and she's not delivering puppies. That's when you need to go in and have help with a C-section. I use a lot of ice cream during labor, not so much for the calcium, because we only kid ourselves when we eat ice cream at night that we're getting a good dose of calcium. Really, we're getting fluid, we're giving energy to the bitches that haven't eaten very well during labor, but we're not giving it for the calcium, we're giving calcium for the calcium. To bring in milk, we use metoclopramide. I use bratwurst like the sausages. I'll use oatmeal, and of course, our favorite, Oxymama, which contains fenugreek and a number of other herbal products that help to improve lactation. The Dealy mucus trap to suction out puppies. This is how Dr. Strupp was using the Dealy. This is how you use it, is you just put it down the puppy very gently into the airway. And with a little stimulation and pulling out the fluid, those puppies will start breathing really effectively. I would never whelp a litter without a Dealy mucus trap. Bulb syringe, alternating with the Dealy mucus trap, they tend to do different things in pulling out mucus and fluid. Dopram, if you have puppies that aren't breathing, this is a prescription-only product you have to get from your vet. Glucose, which can be something as simple as Eagle's brand sweetened condensed milk, just a little energy boost for the bitch and the puppies. Room temperature thermometers, so that you know the temperature and the humidity in the room. Rectal thermometer, and even the teeny tiniest little 2-ounce puppy can have a rectal thermometer with Vaseline on it to know if they're warm enough. The Thunder Ease or the Adaptil collar to improve maternal skills. A digital scale so you can weigh your puppies and assess them for weight gain, weight loss, and how they're doing and how much to feed if you need to tube. A chart so that you can keep track of their weights morning and evening, their temperatures morning and evening, their urine color, and if you've got any notations about any changes. If you have puppies that are hard to get on a scale, they're too big to sit on a scale or they don't sit very still, a fish scale, like in this picture, like the kind you put in your fishing boat, with a mesh bag can be a really useful way to weigh puppies. Gloves, you should not be helping puppies be born. You should not be putting your fingers barehanded into the female's vaginal tract. She should be protected from you by wearing gloves. You need a box to transport puppies if you're going to be traveling somewhere. 5-hour energy will help the puppies to be stimulated to breathe. Put a drop or 2 on their tongue. Chlorhexidine, I think all bitches should go into labor clean. So don't bathe her the day she's going into labor. Bathe her a couple of days ahead of time so she's nice and clean. That will reduce mastitis, metritis, puppies that are sick. It's just a generally good hygiene product to use. I like to have some kind of formula and some kind of bottle and nipple to feed. If I have puppies that need to be supplemented, we carry the Miracle nipple, and we also carry the ones by Puppy Warmer that are a nice silicone, food grade silicone. If you don't have that, Medi Nursers are nice. Of course, our foster care formula, which is the really great formula on the market for newborns. They make a feline and a canine version. Make sure that you're feeding the right one. And this has a number of advantages over other products on the market. It has Biomos, it has psyllium husk, which will reduce diarrhea. It has IgY, which will help stimulate the immune system. Do we want to routinely use antibiotics on our newborn puppies? Absolutely not. But if they have diarrhea, if they have parasites, any of those things can be minimized by the use of some of these prebiotics and the IgY in the product. Again, the psyllium husk will reduce diarrhea. Many puppies have diarrhea. Feeding tubes, if you're going to need to support puppies with tube feeding, you want to have those tubes and the syringes on hand. Very briefly, I'm going to say that we have a great video on our website. I think it's the #1 video that people come to our website to see, is how to tube feed a puppy. So with 5 very key steps of pre-measuring the tube, and pinching the tail and toes before you feed to make sure that the tube is in the right place, you can safely feed your puppies. This shows an image of, I'm gonna lay them on a side, measuring the tube length from the tip of the nose to the last rib, and then passing the tube to the left and pinching before you feed so that you're safely feeding the puppy. Just for the people that say, well, those rump puppies, I think they should probably just die. I'm not going to really try and support them. I'm going to show you that the little Rottweiler puppy in the video I just showed you was itty bitty, not gaining, wasn't keeping up with his brother. We showed the owner how to tube feed. These are the two puppies when they were 8 weeks old. You can't really tell which one was which. And very quickly, he was a winning show dog. So it's pretty effective to feed these guys and keep them going. No one should die of starvation. This is the Canine Reproduction and Neonatology book that we have. Dipping the cords in tincture of iodine is absolutely essential at birth, 2 hours, 8 hours, and then twice a day until the cords fall off. That will keep any bacteria from ascending up into the abdomen. And when I say dipping the cord, I mean you take the tincture of iodine and you put it into a small bottle. You put the cord in it and you literally dip the cord so that the cord is completely encircled by tincture of iodine. If you're losing newborn puppies at an early age and you're not sure why, it may be because the cords are getting infected and causing that. The Royal Canin Starter Mousse, this stuff is like crack. We tell these clients with these puppies, this is a litter of 12-day-old collie puppies that the mother had mastitis and was pretty sick, was having a hard time nursing the puppies. Without their eyes open, they were already interested in starting to eat. So this Royal Canin Starter Mousse is amazing crack stuff that we feed. Planning for a C-section, it's important if you're going to do this that you do have planning done in advance. Scheduling it is really critical so that you're not catching your veterinarian off guard. Again, these are the whelping supplies that we recommend. And if you are traveling for a C-section, you may want a few extra things along just to have, because if you're in the car and the bitch goes into labor and has a puppy, or you're heading home with a litter of puppies, you want to make sure that you've got enough good stuff on hand to help support both her and the puppies on the way home. When we time our C-sections, we go 63 days from ovulation, and then we'll back off 1 day for most litters, 2 days for the brachycephalics or especially large litters. One of my staff members took our whelping chart and she punched 2 holes in it so that it was easier for her to follow the line across. I thought that was really funny, that she took a rubber spatula and lined it up that way. We know C-section puppies have a higher survival rate than vaginal birth puppies from the data that Paula Moon collected back in 2002, that we see a 5 to 6% higher survival rate if puppies are born by C-section. So before you have a C-section, you want to work with a veterinarian, a practitioner that you understand and they understand you. There are gas and injectable anesthesias. Alfaxin or propofol are the injectables that we recommend. We recommend sevoflurane for the gas, and then Metacam or Rimadyl for post-op pain management. Those are the safest anesthetic protocols. You need to avoid using ketamine, Rompin, or dexdomitor as anesthetic agents, or only doing a local anesthetic block to do a C-section. Those are really not a good way to handle things. Ahead of time, you want to make sure that the female has steroids to improve the lung function of the puppies, that she's had calcium to improve her maternal skills, that she's wearing an adaptive collar, and she's getting Reglan, again, to improve maternal skills and lactation. During surgery, all my bitches get IV fluids. I would never recommend a C-section without an IV line and IV fluids. We like to clip the bitches ahead of time so they're under anesthesia for the shortest time possible, from the time that we give them the first drop of anesthesia till the time the first puppy is born, so that they are shaved ahead of time. I like to have a C-section team of staff that are aligned. They know what's where, they know what they're going to do. Each person has assigned tasks so we can really rock through a C-section, because the shorter the time period under anesthesia before the puppies are born, the better your survival rates will be. We want them to rapidly be delivered after induction, and having a trained staff for both doing the C-section and resuscitating the puppies are essential. And we never, ever, ever, ever recommend spaying at a C-section. Post-op, if you save some placental fluid and give her some oxytocin and some pain meds, she will be a better mother. I use adhesive drapes on our bitches for C-sections so we don't have to scrub their nipples. It makes it easier for the puppies to find the nipples if they haven't been scrubbed. The adhesive drape allows us to only scrub the incision without having to take the oils off of the nipples that help the puppies to find the place to go nurse. C-sections do cost money. the place to scrimp is not on a C-section. If somebody's doing a really cheap C-section for you, you need to be suspicious that they're maybe not getting enough staff there for help. They may not be using IV fluids or the right anesthesia, and that they're recommending some things that are not the ideal situation. I would never recommend a discounted parachute. I wouldn't buy my parachute on eBay, and I wouldn't do a discounted C-section. I think you should expect to pay a decent amount of money for a great C-section. Losing 4 puppies out of a litter isn't worth saving a couple $100s on a C-section. Provider care is number 6. And I think it's really important that you pick a good provider, a veterinarian and a veterinary team that you can work well with, that get along well with you. They understand you. You are consistently getting your care there. If you're hopping one vet to the next, it's very difficult for continuity of care. And I speak to this as a practitioner for clients that say, well, you know, I go to one place because it's cheap to get my vaccines, and I go another place because it's cheap to get. It's like, no, it's not about that. It's about having a good relationship. It's about having them available when you're in a crisis, because you are reliably their client and only they are your only vet. You're not hopping around. You're not doing yourself any favors by doing that. If it's something that's an emergency, you may end up at an emergency clinic anyway. So be thoughtful, be considerate, and be consistent with your veterinary care. Again, we have a couple of books, the Pandemic Puppy Book for puppies and the Canine Reproduction book. Shelley, what have you got?
We encourage you to scan that QR code for a lot of these products Dr. Greer is mentioning. I know she has mentioned a ton in the last few minutes, especially. So if you're interested in any of these, you want to learn more about them, scan that QR code. It'll take you to our website. Otherwise, again, call our animal care specialists. They can help. And then we have these bundles, right, Dr. Greer? We do have a lot of exclusive bundles at Revival. It's kind of a good way to get a lot of these products that Dr. Greer is talking about, and you save money because you're buying them in a bundle. So these are just a few of them. We do have a lot more bundles available. So again, here's a couple more. A whelping bundle. We have vaccination and microchip bundles because, again, important things to have. And again, there's that whelping kit QR code that Dr. Greer mentioned earlier. Our whelping kit, it's really, it's simplifies this whole process. You kind of go through and you check, okay, I have that, I don't have that, and you can just easily add it to your cart, and kind of a one-stop shop, like it says there, for all your whelping supplies. Okay, so first question. Somebody's wondering if Apoquel, Cytopoint, Zenrelia, are they safe for pregnant dogs used for mating? What kind of medications are they? They want to learn a little bit about those.
Sure. Cytopoint's a monoclonal A antibody. The Zenrelia and Apoquel are more similar to each other. They're JAK blockers. None of those are tested or labeled as safe in breeding animals. The other point being that we know allergies have an inheritability. So the question is, should you be breeding, especially females that have allergies? Steroids are not safe during pregnancy, and we don't have any data on those other products. So I am pretty hesitant to breed dogs with allergies.
Okay. Deborah's wondering, for pregnancy confirmation, do you recommend ultrasound? Excuse me, I'm losing my voice here. Ultrasound or a pregnancy test?
Absolutely ultrasound. Pregnancy test tells you if you have placentas. It doesn't tell you if you have healthy puppies. It doesn't tell you if they have heartbeats. It doesn't tell you how many. It doesn't tell you if you had 10 and then you lost 4 for resorptions and then you ended up with 6, or in the case of some bitches that they've lost an entire litter. So I don't recommend the pregnancy test. I recommend ultrasound. Absolutely ultrasound.
Okay. We have a couple questions wondering, she's wondering about her female. She's a French bulldog in this case. She's tried taking to pregnancy twice now, but it's just not working. She's been using Be Strong. The breeders had Be Strong, but she's wondering what are some other things she could ask her vet to check when she's ready again to try breeding again.
Diet. You don't even have to talk to your vet about diet. What else do you feed? And supplements are going to be the first 3 things. Thyroid is what a lot of people want to test for, and some people even supplement, but it's rarely the cause of a problem. So I recommend Lyme disease testing, Anaplasma and Ehrlichia, because we see a lot of those bitches having fertility issues. So I look at nutrition, I look at the infectious diseases, brucellosis, of course. And then if that's still not getting you where you want to be, then you can talk to them about what other options they have, or you can certainly call and I will email you back and we can have a conversation.
Okay. We have a couple people asking about resorption. Just wondering, can you talk about that a little bit, like possible
Yeah.
causes, ways to prevent it? Somebody's wondering the role progesterone may or may not play
Sure.
when it comes to resorption.
Yeah, and resorptions are one of those kind of mysterious things that we don't understand completely. It may be nutrition based, it may be infection, it may be stress, it may be something else that caused her to not have a normal pregnancy. There are two causes for progesterones to drop during pregnancy. Primary means that she didn't make enough in her ovaries. That is extremely rare. A lot of people want to blame it. A lot of people want to do progesterone supplements. It is extremely rare in dogs. Does it happen? Yes, but I manage hundreds of pregnant dogs a year, and we may see one a year that has that, or maybe not even that many. The secondary cause for progesterone to drop, if you're watching progesterones and it goes down lower than it should, lower than 3, would be some underlying cause that was wrong with the pregnancy. It could be herpes that the puppies had. It could be Lyme disease that she has. There's a lot of reasons for that. Again, it can be nutrition. It can be stress. It can be a lot of different things. We will recommend a diagnostic workup. There's a profile that's run at Cornell at the vet school in their diagnostic lab called the Canine Abortion Panel. Now, a bitch doesn't have to literally abort a litter, like lose it vaginally, and deliver premature puppies to run that test. Any kind of pregnancy loss can be assessed on that. It tests for lepto, herpes, brucellosis, thyroid, neosporum, toxoplasmosis. There's a whole array of tests. So if you look at the Cornell Veterinary Diagnostic Lab website and put in canine abortion panel, it will show you what tests are done and the blood sample that you can ask your vet to draw and submit. I believe it has to be submitted by a veterinarian. I don't believe you can do that yourself. Unfortunately, we don't always find the cause. Sometimes it's cystic endometrial hyperplasia, meaning that the lining of her uterus was all bumpy and weird and the placentas didn't get good attachments. Sometimes we never figure it out. You probably do want to try to figure it out, but only about 30% of the time is the underlying cause discovered. Sometimes we go as far as uterine biopsies to try and diagnose the problem at the time that the puppies would have been born. So again, if you're kind of hitting a brick wall with your vet, send me an email and I'm happy to go into some detail with you.
And we encourage you, if you reach out to our animal care specialist, they can kind of help get you in touch with Dr. Greer there. So give that number a call and they can help with that. We have a couple questions. People are wondering, they're similar questions about, is there any evidence that prenatal vitamins for dogs could contribute to birth defects if properly formulated or administered?
We have not seen that. There are thousands and thousands and thousands of dogs over the years that have taken the prenatal supplements that we carry, and there hasn't been any evidence of any issues with that would show any kind of a pattern. Anything random can happen. People can blame things that may not really be related, because we know resorptions, probably 30% of conceptions in dogs end up in resorptions. And that's like a really huge number. In human pregnancies, 1 in 6 ends up as a miscarriage. That doesn't mean that they took the wrong supplement. It just means sometimes there was something unhealthy about the pregnancy, the uterus. Something can go wrong that we don't always have an explanation for.
Susan is wondering, if her female had a C-section, can she have a natural delivery the next time?
Well, it depends on why she had a C-section. If she had a C-section because she's a pug, she's still a pug. We didn't stop her from being a pug. If she had a C-section because she had one puppy, or she had a log jam, or a puppy was malpositioned, or a puppy was too big, then she may go ahead and have a normal delivery the next time. But if it was something maternal, if she had a vaginal stricture, if she had a pelvic fracture, if she's got some other reason that she wasn't successful, she had primary uterine inertia, she may end up with the same thing again. So the answer is, it depends. There are safe ways to have a litter after a C-section. The uterus should not rupture, but the cause, knowing the underlying cause, would be the determination of whether she would need another or not.
Okay. Several people have asked more about folic acid. They're wondering, when to start. Do you do it the whole pregnancy? Do you do it after pregnancy? And which sort of supplements do you recommend that contain folic acid?
Sure. So folic acid should be started at least 6 weeks before the heat cycle starts. So if you think she's going to come into heat in January, you want to start in November. You want to give it every day from the time you start it until the puppies are 40 days pregnant. That's what seems to be the time period that we have the risk of midline defects. Folic acid will reduce midline defects, including cleft palate, spina bifida, open abdominal wall, all those defects. Yes, it should be given consistently. And we have several products in our product line. Like I said, there's only one published dose that says 5 milligrams per dog per day, but that's a really high dose. So most dogs, small breed dogs, are not going to get that large of a dose. But we have Be Strong. We have a number of other products in our catalog that do contain folic acid that would be useful. And the human over-the-counter product is fine as well, but it's not going to be palatable like the Be Strong and some of the products that we carry, that the dogs are just going to be very happy to be like, oh, yay, I get a treat today because it's a revival treat. Don't tell them it's folic acid. Tell them it's a revival treat.
Right, exactly. It's much easier to give a dog a treat that they like. Sandy's wondering, how long after a vaccine is it safe to breed?
I like to be sure that they haven't had an adverse reaction. So if it's a week, that's fine. Typically, if they're going to have an adverse event, it's going to be in the first 24 to 48 hours.
Okay. Marcy's wondering, how do you best manage preterm contractions or labor?
Whelpwise. You need to use a Whelpwise service if you have that accessible to you, and they're based out of Colorado. There are some drugs that can be given, but those need to be prescribed by your veterinarian. It may be progesterone. There's several different kinds. It may be terbutaline, which is an asthma drug for people, but it's a smooth muscle relaxer, which is how it works on asthma. As your trachea, your bronchioles are made of smooth muscle, so is the uterus. You should not routinely be using progesterone without your veterinarian's intervention and not knowing why it's dropping, how far into the pregnancy is, and what kind of progesterone, because there are several on the market, some which are not safe until after day 45. Do not routinely put all your bitches on progesterone. You're going to regret that.
Deborah's wondering, is it okay to have anal gland expelled in a pregnant dog? Does pregnancy contribute to anal gland clogging?
No, it is absolutely safe to have them expressed. They won't create any issues. And I don't think I've ever seen a pregnant dog have an anal sac infection. That's a really interesting question. It's absolutely fine to have them expressed. There's nothing that's going to upset the pregnancy from doing that.
Okay. Well, thank you again, Dr. Greer. So much great information here. Thanks for watching. Make sure to subscribe to our channel so you're up to date with all of our latest videos. If you have an animal health question, be sure to give us a call at the number below and check out our other animal health videos.